Welcome to our second part of cardiovascular physiology revision, which is based on MCQs. So today we are going to cover the MCQs related to cardiac cycle. Following occurs during ventricular systole. Ventricular systole means contraction of the ventricle. So during contraction of the ventricles, the blood is pumped out of the ventricle to the aorta and pulmonary. So the semilunar valves have to open and AV valves have to close so the blood doesn't go back into the atria. Other options here are wrong because blood flow into the ventricle that happen during ventricular diastole, not systole. Blood flow out of the atria, again, that happen during ventricular diastole. Semilunar valves close, that is wrong option because semilunar valves have to open for the blood to get into the aorta and pulmonary. Which event occur when the pressure in the ventricles becomes lower than the pressure in the atria? There is one important concept in cardiac cycle, which is blood flow from high pressure to low pressure. So in that case, you have here atrial pressure higher than ventricular pressure. So that means there will be ventricular filling happen, means the ventricle will relax. So what happened during that phase? Will the ventricle contract? That is wrong because the pressure in the ventricle is even lower than atrial pressure, means that is going into relaxation, not contraction. Blood flow into pulmonary, that again happen with contraction of the ventricle, so it's wrong. Blood flow into aorta, again that happen with ventricular contraction, so that's why it's wrong. The last option here is AV valve is open. That is a correct option because once the ventricular pressure becomes lower than atrial pressure, the blood will flow from atrium to ventricle according to pressure gradient, and does that require AV valves to open. So this is our correct answer. And remember always that concept about blood flow from high pressure to low pressure. And that also apply to the changes which accompany cardiac cycle. So once the pressure in the atria is higher than ventricle, the blood will flow from atrium to ventricle during diastole. The first heart sound is heard during which phase of the cardiac cycle? We know during the cardiac cycle, we have first sound that indicates the beginning of systole, second sound which indicates the beginning of diastole, then we can hear third and fourth sound. So third and fourth sound are also heard during diastole. Okay, so third sound is heard during ventricular filling, then fourth sound come after that, so it comes during atrial systole. So first heart sound indicates the beginning of systole. So which of these phases indicates the start or the beginning of systole? It is the isovolumetric ventricular contraction phase. Okay, first sound is heard because of the sudden closure of the AV valves, and that happens during isovolumetric ventricular contraction phase. During which phase of the cardiac cycles the dicrotic notch is observed? Dicrotic notch, this is like aortic pressure increase during systole, then during diastole it goes down. Once the aortic valve closes, okay, and the backflow of blood towards the closed valve makes that notch in the graph for the aortic pressure, that is known as dicrotic notch. So dicrotic notch is seen at the beginning of diastole, once aortic valve closed, and does that happen during isovolumetric ventricular relaxation, which indicates the start of diastole. So remember here, start of diastole is indicated by the isovolumetric ventricular relaxation phase. And the start of systole is indicated by the isovolumetric ventricular contraction phase. Which of the following occurs when the pressure in the aorta exceeds ventricular pressure? So if the pressure in the aorta here gets higher than the ventricular pressure, this valve, which is known as aortic valve, has to close so the blood doesn't go back into the ventricle. So the correct answer here is aortic valve closes. A 65-year-old man with a history of heart failure presents with increased fatigue and shortness of breath. On physical examination, his jugular venous pulse is noted to be elevated with a prominent A wave. This finding is most likely associated with which phase of the cardiac cycle? So you need to know the jugular venous pulse curve has 3 positive waves and 2 negative waves. The 3 positive waves are A, C, V. And the 2 negative waves, X descent and Y descent. So you need to know which each of these phases or each of these waves happens during which phase of the cardiac cycle. So remember A for atrial, okay? So A is atrial systole. So when the atrium contracts, the pressure in the atrium increase, and the increase in atrial pressure causes the increase in jugular venous pressure as well. And that makes that positive wave, which is known as a wave in the jugular venous pulse curve. So these are quick revision of the jugular venous pulse waves. So we have A for atrial systole. We have C for ventricular contraction. So C, contraction of the ventricle, the isovolumetric contraction phase. We have V for atrial venous filling. So A, C, V, they are all positive waves. During these waves, atrial pressure increases, and that will be reflected in the jugular vein. A, atrial systole, C, ventricular contraction, isovolumetric contraction, and V for atrial venous filling. X and Y, they are negative waves, which these waves represent a decrease in atrial pressure. The decrease in atrial pressure happens during ventricular ejection and also happens once EV valve open and the blood move from atrium to ventricle. So once the semilunar valves open and once the EV valve is open, so we can see the descent in the jugular venous pulse. The following decreases during ventricular ejection. So here the ventricle is pumping the blood out into the vessels. So which of these decrease? So ventricular pressure, of course, during ejection, the ventricle contract, so ventricular pressure increase. So that is wrong. Aortic pressure also is going to increase because the blood is pumped out into the aorta, so aortic pressure will increase. So ventricular pressure increase, aortic pressure also increase. Ventricular volume, that is going to decrease because the blood is pumped out, so it decreases. Atrial pressure, so atrial pressure increase because we have venous return going on. Ventricular pressure is the highest during which of these phases? Rapid ventricular filling. During ventricular filling, the pressure is actually low so that blood can move from atrium to ventricle. Okay, so for the blood to come in from atrium to ventricle, we need actually low pressure in the ventricle. And during ventricular filling, the ventricle is in diastole, is relaxing. So the pressures there will not be very high. So it's not the highest pressure. So rapid filling phase is wrong. reduced filling phase is wrong because they are both diastole. So come to these two options. We have ventricular ejection. So the ventricle is contracting. And we have isovolumetric ventricular contraction. Again, the ventricle here is contracting. So during which of these two phases, we have the highest pressure. So the correct option here will be D, because during isovolumetric contraction, all valves are closed and the ventricle is contracting. So that is going to increase the pressure in the ventricle. Okay, during ejection, the pressure also increased. Yes, of course, because we have here like high pressure because of the contraction, but it will start to pump the blood out already. So the volume of the blood decrease, and that will slowly causes reduction, especially during the reduced ventricular ejection phase. The pressure in the ventricle during ejection increase and it goes down. So during early ejection, the pressure will be high. Then at later ejection, the pressure will be a bit lower. But the highest point will be at the beginning to overcome the high pressure in the aorta and open aortic valve. Third heart sound is heard during atrial systole, rapid ventricular filling, or isovolumetric ventricular contraction, or isovolumetric ventricular relaxation. So let's look at this this diagram here. So we see systole and diastole. Cardiac systole is indicated. The landmark for the start of systole is the first heart sound to be heard. The landmark for diastole, the start of diastole, is the second heart sound to be heard. And we can see here the duration of diastole is longer than the duration of systole. So first heart sound, which indicates the beginning of systole, it's heard during isovolumetric contraction because of the sudden closure of AV valves. Second heart sound is heard during isovolumetric relaxation because of the sudden closure of the semilunar valves. Then come in sequence the other two sounds. So the third heart sound is heard during rapid ventricular filling phase. Then fourth heart sound is heard during atrial systole. So the third heart sound is heard during the rapid ventricular filling, where the blood comes in from the atrium to the ventricle quickly because we have like a pressure gradient. Then fourth heart sound is heard once the atrium contract to push whatever additional blood left in the atrium into the ventricle at the late part of the ventricular diastole. So remember that these sounds are actually numbered in sequence based on their position during the cardiac cycle. So start of systole, you hear first. Start of diastole, you hear second. Third and fourth, you hear them during the diastole. But remember that the fourth heart sound is pathological and third heart sound is pathological, except if you hear it like in condition like in children, for example, it can be normal.